Vasectomy is a permanent sterilization procedure that many men choose for contraception. When a patient of mine is coming in and wanting to have a counseling visit about what vasectomy is and how to prepare for a vasectomy, we have to go over a few things. One of the issues is that they will need to have an explanation of what vasectomy is. After they have essentially decided that they want to proceed with this procedure, we'll have them sign a consent form that will help them to make sure that they are indicating in writing that they want to have a permanent solution for contraception, so that they want to have permanent sterilization. After they have signed a consent form, I will review with them what they need to do to prepare for the procedure. Prior to the procedure, a few steps will really help with the comfort during the procedure, and also to help them with the aftercare of how to take care of themselves after the procedure. So one of the things that I have men do prior to coming in for their vasectomy is to go out and purchase an athletic supporter. A tight athletic supporter will help to support their scrotum and testicles so that there's less discomfort, and also so that there's less chance of developing a small blood clot called a hematoma. So that is what they will wear when they leave the office after having the procedure. Another recommendation is to have them take some medications before the procedure so that the procedure is generally more comfortable. I will give my patients usually a prescription for sedatives such as Valium, and also some pain medications that they can take maybe one tablet before and to be able to continue taking after if they have pain after the procedure. And so approximately 1 hour before having the procedure, they may take one tablet of Valium and one tablet of a painkiller to be able to have less discomfort. Also, if they don't have a problem with taking ibuprofen, they can take 800 milligrams of ibuprofen prior to the procedure. Also, we recommend that they stop taking any medications that could cause thinning of the blood and more bleeding during or after the procedure. These medications include aspirin, vitamin E, fish oil, and there are some other medications that can do this, including blood thinners like warfarin. So if you're taking any medications or vitamins, supplements, you should discuss this with your doctor prior to having your procedure to see if you should stop these approximately 1 week before the procedure. Another recommendation is that the hair of the scrotum be trimmed so that it makes the procedure easier. And we don't recommend that you use clippers. We recommend that you use scissors to just very gently trim the hairs on the scrotum. And if you want to shorten the hairs around the groin as well, you can do that. Finally, if you have taken any medications that are sedatives before the procedure, you'll need to have somebody to be able to be with you during the procedure and to drive you home afterwards. The procedure is generally not all that uncomfortable, but most men don't want to drive after they have this procedure, so that's probably just a good idea in general. But that's pretty much all that you need to know about preparing for this procedure. And if you have any questions otherwise, you can bring that up with your doctor at your pre-procedure counseling visit.
Medtwice.com